Thank you very much, Dr. Noha, for your presentation on the Egyptian regulations, which is very informative and very interesting to see. And
Thanks, Ibrahim.
I'm personally interested in the list of deficiencies that you mentioned, the common deficiencies, which is interesting to see.
Thanks.
I would like to invite the other speakers, Dr. Nazilia and Dr. Sheda, to join us now for the panel discussion. So, hi, Dr. Nazilia. Hi, Dr. Sheda. All right, so now we will conduct our panel discussion, and some of the questions that were previously asked to the panelists. Let me see. One question was asked to Dr. Sheda for the QC testing. 1 minute, please. The question is about the timeline for the quality control testing, and what is the usual timeline for this?
Usually, once you submit your file to QC lab testing, it will be evaluated and comment will be given within 2 weeks of submission. Comment on the analytical method. Once your analytical method or once your method of testing is validated and it can detect all the specific, and it match with the specification supplied to the QC lab testing, then you will provide your sample to QC lab testing, and lab testing will be conducted. And if a sterility test will take 2 weeks. So it's only depend on the manufacturer and their preparedness, and how their analytical method is valid and can valid, precise, and can test all the requirement according to their analytical method. Many problem we face that we have a weak analytical method, and mainly in failure. This is our delay point, as we said, since they take a lot of time at lab. Their analytical methods sometimes are not valid, and sometimes it cannot precisely measure the active ingredient, and some sample may fail for the appearance test. So once they work hard on this part, analytical testing and finished product specification, they will pass the laboratory testing quickly, and after that, within 45 days, it will be either registered or rejected based on technical committee assessment.
Very interesting. Another question on the testing as well. You mentioned that there is the registration testing and there is the importation testing, quality control testing for the importation. Can you please elaborate more on the importation testing for its duration and the nature of that?
Importation testing, once your finished product specification and analytical method that was submitted by the GFDA is the same, so in importation testing, you will not, they will test according to the approved finished product specification. It's mainly, sometimes it's take maximum 2 weeks for passing the tests. And if there is any change in the finished product specification or analytical method, this will cause a delay, as they have to re-evaluate the new analytical method or the new finished product specification again. So once we approve the finished product and analytical testing, it will go for the it will go to the analysis path.
I see. Thank you very much, Dr. Sheda. I think you adequately answered and addressed the question regarding the importation lab testing. I have here a question to Dr. Noha with regards to the easy pathway or fast path track registration in the EDA. So how can anyone apply for the fast track?
According to the platform, you have to choose the pathway of your product. Either it's normal or it's fast. It only depends about the fees. If you choose the fast track, you have to pay 20,000 Egyptian pound, and it will take a shorter time That's to say, if our regular timeline for the normal track is about 6 to 8 months, the fast track will only take about 3 to 6 months, and all depends about your documents. If your documents are perfect, you don't have to check anything, and you don't have any problem from the common mistakes that I mentioned before. So your file may take about 2 months or 3 months maximum.
Thank you very much. Since you mentioned that it is through the website,
Platform. Yeah. There is
one
an icon that you have to press and choose whether you are fast track or normal track. And before you have to be paying the fees for the fast track.
I see. One delegate is asking about having restricted access to the website outside of Egypt. Is this something that the EDA is working on or
Yeah,
addressing at the moment?
we are working on it now. But this person trying to get from outside, does he have a company profile, username, and password?
I will, if the person who asked the question, do you have, if you can reply if you have access or username and password to the EDA website, or I believe you mentioned the agent perhaps, so this might be the source or the solution for this problem.
Yeah, we are now working that this website, in order to apply on it, you must be registered in EDA at our company profile, and you get your name and password, which is for the agency or the scientific office, through which you can enter the platform. But up till now, we still have a lack of communication with person outside Egypt, and soon, inshallah, it will be resolved.
I see. Thank you very much, Dr. Noha. I believe Nazilla have some question from her side as well. She wants to share with us and to see the authorities' feedback on it right away. So
Thank
go
you
ahead,
so much,
Nazilla.
Dr. Ibrahim. Yes, whilst we have the opportunity, Dr. Noha, Dr. Shatta, I'd love to get your opinion. Do you believe that for manufacturers, it would be beneficial to have more of a direct approach with the technical committees so that the R&D teams of these global manufacturers could be in touch with the technical committees? Maybe this could add more of a value in terms of the pathway to have this connection to be able to have a beneficial development. Do you think that this would be added value?
For me, I guess it would be somehow a conflict of interest. So we prefer that the technical committee, no one knows who are the employee or who are taking the decision. I guess so.
Right. This is always a question that pops up, so good to know. Thank you. And the second question I had, Dr. Shatta, was would you think it would be beneficial to encourage manufacturers to launch first in your market with the innovative products? So when we have new pipeline products, do you believe there would be an added value to encourage manufacturers to launch first in the Middle East?
Yes, yes, I think it will be encouraging and interesting. As I said before, we have the first model of independent legal authority in region. So it will be yes, it will be beneficial. And some countries in the area around Jordan, they follow the Jordanian regulation, and they follow once they know that this product is marketed in Jordan and registered in Jordan, they will be more they more be comfort when they accept or reject that product in their countries.
Excellent. Thank you so much, Dr. Shatta.
And I would like to know that any manufacturer or anyone could access to GFDA website and search for the registered product. It's published for public. Anyone can access and anyone can know what is the product that is marketed in the Jordanian market.
Excellent. Thank you so much for your insights. Thank you, Dr. Ibrahim.
Thank you, Dr. Roha and Dr. Shada, for providing the direct feedback on Dr. Nazilia questions. One more question we have is with regards for legalization of documents. Is there any concerns or any pathway to do it, keeping in mind that the current pandemic situation is causing many delays in the legalization? Like, for example, are you accepting any commitment letters for legalization, or this is something that at this point is a strict requirement?
This is for Egypt
Doc-
or
Dr. Noha, Dr. Shada, any one of you feel free to answer.
Yes, for GFDA now, as we know, this pandemic, the main reason, our main aim is to provide the product in the market, improve access with maintaining equality. Yes, we can at the moment, we can accept for evaluation purpose, we can accept the registration file with copies and commitment to provide us with an authorized copy or the original copy, but it will not pass the registration process, and it will not pass registration unless they provide us with the original copy or notarized copy. يعني if we accept to submit registration file at this point, we will save around 2 to 3 months for the manufacturer or for the applicant. They can be prepared, evaluated, and once they get the original or notarized copy after 1 2 months, يعني already the registration file will reaching the final stage of assessment, so can be registered with the original certificate. But no, we will not stop submission based on the presence of original or notarized copy. And you can submit your file, but you cannot register it unless you provide us with the original copy.
Brilliant. So it's basically to make use of the time while the documents are legalized, you can review and assess the documents that are submitted.
Yes, and they will have time to support us and provide us with their deficiencies. And this time, and they will gain or win time to provide us with the copies.
Interesting. Is it the same situation with the EDA or?
Yes, it's the same. Last year, due to the complete lockdown, we accepted to finalize our files without legalization, or be waiting for it for the last steps. But now we do not finish the registration file unless the documents are legalized. Except for the certificates, as I mentioned before, that we can check if the notified body can is on website. We can check it, and we don't wait for the legalization of the certificates. Otherwise, the documents like authorizations that must be legalized, we do not finish the registration cycle unless it's legalized.
It's very interesting that you mentioned the notified body certification and the validation through the website, because one of the question is for with the EDA for the certificates validation. Most of the notified bodies have websites to help the
Yes.
authorities to verify. So does the
Yeah.
EDA plan to approach or use these websites instead of the emails with the notified bodies, or?
We are already using it, but sometimes we have to communicate with the notified body if there is missing the data in the certificates. Sometimes the actual is not mentioned in the certificate, so we have to check from the notified body if it's covering this site or not. Otherwise, if all the data are mentioned in the certificate, so we can only check from the website about the validity of the certificate on. And we already use this website for checking.
Brilliant. One more question to Dr. Shada for Jordan. Does the actual manufacturer, or if the manufacturer change, does it require a new registration, or it's only a variation submission? The actual
It's only
manufacturer.
Yes, it's only a variation submission, but you have to provide us with a declaration that manufacturing process from the new and the old one, the approved and the proposed one are the same. It will be an addition if the applicant provide us with certificate of analysis from both manufacturer, if the same composition, same finished product, and same manufacturing process. No, there is no need for a new registration. And the certificate should be submitted to make sure to know what is the exact changes. Justification should be submitted also for this change, but no, changing manufacturing site does not require a new registration.
Interesting. Another question to Dr. Nuha for Egypt. For the quality control, is it only sterility testing required, or is there other tests like test of active ingredient also required?
No, we don't need active ingredients, only sterility test.
So it's only sterility testing in QC for Egypt.
Yeah.
With regards to the Egyptian regulations, if there is a problem accessing the website from outside of Egypt, is there a way to communicate or to request the EDA to share the regulations, maybe through emails, or at this moment the only way for sharing regulations is through the website? Because if someone is outside of Egypt, he may not have the access to a website.
You mean that this person is missing the access to get the regulation and enter the website, or he needs to apply on the platform?
No, the question is regarding the regulations, to access the regulations.
Regulation is published on the website. Anyone can see it. I can send you the website, and it's published. Anyone from all over the world can see it. But regarding the platform, it's now having miscommunication outside Egypt, but it will be resolved soon. As you know, if you try to contact anybody, we have launched our first stage for the registration last July, and we are now completing the second stage for the importation. So we are still having a lot of headache to finish this phase. After then, we will try to solve the problem of contacting outside Egypt. But about the regulation, all the regulation are published on the website.
Interesting. I have a question to Dr. Nazila. It's with regards to having many white label, non-branded HL filers passing the same regulations. How will this impact the original brands if there is a non-branded filler that is being marketed or something like this?
Yes, that's a very good question. I think it really comes down to the vigilance of the authorities. So once you've gone through this process and the registrations of products have been accepted, we would assume as manufacturers that all the due diligence has been done from a technical perspective, safety perspective, efficacy. So having more competition is always growing the market space from a commercial aspect. So although it may look negative as a first point, but to grow the industry is obviously where competition is healthy.
Interesting. Another question here with regards to the website, since you mentioned it for Dr. Noha. Can you please share the website and your email if someone wants to request the
I'll share it
regulations?
now.
Because we have a website over here, the me device.
This is a website for applying on the platform. This is not the website. Yeah, this is the platform. I'll send it now.
Mm-hmm.
We can continue now until I get
All right,
it.
sorry. Yeah. All right. Okay, I will move to the next one. So one of the question is to how to assess the SRA approved medical devices and how long it takes to grant the certificate.
In Egypt?
I think both Egypt and Jordan might have the ability to answer this question.
Can you repeat the question, please?
Sure. How to assess the SRA approved medical device and how long it takes to grant the certificate, the SRA approved medical device. So it looks like, to be honest, I'm also not familiar with what the SRA means. Maybe
What is
it
the
was.
SRA?
Yeah, I'm also not familiar with it. I was hoping so. You might have known it, but no problem. If the delegate can clarify his question, maybe we can ask it in a more clear way to our speakers, and they can provide their feedback. In the meanwhile, let's see another question. Yes, Dr. Sheda, Is there any chance to set an online registration system in the GFDA instead of submitting hard copies and technical committees revision, which usually takes a long time? Is there any plan for digitalization with the GFDA?
Yes, we are working on this. Already we have an workflow system for drug registration, and you can you can contact the applicant directly without deficiency letter, without papers. You can submit your file, and now we are working on this experience to transfer this experience to a medical device. We are working on this software and move toward the digitalization. Until now,
Brilliant.
we have an electronic system just only for appointment reservation and variation submission, and for importation, exportation invoices requests. But for registration file uploading like ACTD in the Americation, yes, we are working on that right now.
I see. And is there an ETA, an expected timeline for it, or it's in an early stages? It's a project in early stages.
Yeah, it's an early stages. So
Okay.
we are now defining the general criteria. What is the accepted criteria, and what is the requested field to be filled by the applicant, and about the accepted requirement, and the process cycle of processing, starting from providing the document until the assessment and finished by the registration.
Good. Yeah, it's an interesting project, I think, as many authorities around the world are implementing very similar systems for both drugs and medical devices registration.
Yes.
And I think you already mentioned that there is already a portal in the website for the GFDA to identify all registered medical devices. So this is
Yeah.
something also good to have. Dr. Shada, there is one question with regards to toxins. Are RX should be registered as RX only and should be priced even in as aesthetic product like fillers?
What X?
I think here the question is with regards to prescribed or if a filler contain toxin. So
Yes, a filler containing toxins is a drug. It's regulated under a drug directorate, and it is underwent a pricing process as a drug. They request for a price certificate from country of origin, price certificate from median country, and the sales price to Saudi Arabia. Toxins are regulated as a medication, so they follow the rule of medication pricing. Filler, it's a medical device, and until now we don't have pricing for filler at the moment.
I see.
And even a pricing process for medical device is more complex and more challenging than pricing medication.
Interesting. Yeah, this is an interesting topic, and I think it's also a good segue since this panelist session. I think it's almost done now. I want to
I
thanks
can share
again.
only بس the website for IDA.
Yes, yeah,
It's
the website. Sorry,
yeah, it's www.idaegypt.gov.eg. Yeah, this
Egypt.gov.
is the website for all departments, and you can check any regulations regarding pharmaceutical, herbicides, medical devices, anyone.
I will take the chance to share also
Yes,
GFDA website.
Egypt, yeah, as it's written here.
Yeah, please, if you can share the GFDA website as well, so that our delegates can access it to obtain any regulations or anything that might be useful for them. Can you
It
please
is
share?
www.jfda.jo.
www.gfda.jo. It has been shared with the delegates. Thank you, Dr. Shada. Thank you, Dr. Nuha, Dr. Shada, Dr. Nazila, for this interesting session. I believe hyaluronic acid is a very interesting category of medical devices that is it's unique in how simple and how complicated it is at the same time, and the challenges it brings to both regulators, industry, and even sometimes the healthcare providers. So it's a very interesting topic. Thank you all for joining the ACRAS